both addiction and mental health. Twice the battle, but we have to talk about it and we have to face it every day. Let's get into it. K-Rugs, the Soberdog, coming at you. This is something essential to talk about. So important, because if you have both, or somebody you know, addiction and mental health disorders or issues, if one falls, so will the other, almost guaranteed. We have to treat and fight them both on a daily basis. I'm somebody with both, dual diagnosed, co-occurring disorder, whatever, you know, there's a couple of different names for it. Just how many people have both? Roughly 50% of individuals with severe mental disorders are affected by substance abuse. 37% of alcohol abusers and 53% of substance abusers have at least one serious mental illness. And of all people mentally ill, 29% abuse alcohol or drugs. That's according to JAMA, Journal of American Medical Association. That's a lot. Basically, the number that a lot of people throw out there is 50%, which is pretty accurate. Roughly 50% of people with one have the other, or vice versa. And it's a battle we have to fight daily. Myself, I have first diagnosed with seasonal affect disorder, you know, when it gets real, especially where I live, northern New York, you know, in that wintertime, November to March, it's like dark at 5 o'clock, cold, gray, snowy, and my body just shuts down. Then after all the concussions, I got 5 documented concussions, a couple more that aren't documented that happened during some tough times. After all those, the post-concussive symptoms, all the depression that comes with that, the insane mood swings. And then another doctor said PTSD from the year of isolation and solitary and all that comes with that. What that all comes to, I don't know, but what it's diagnosed as now is a major depressive disorder. My point bringing that up is I have to fight that daily along with recovery. Have to keep recovery up and that up. And there's a lot of things that work together. It's a lot of things that help both recovery and that, but there's certain things that are separate that we have to keep them both working, you know, and cranking up on a good level. So a serious mental illness, or an SMI, is defined as any time during the past year a diagnosable mental, behavioral, or emotional disorder that causes serious functional impairment that substantially interferes with or limits one or more major life activities. Some of these include schizophrenia, bipolar, and major depressive disorder. About 1 in 4 people with SMI, serious mental illness, also have a substance use disorder, an addiction. So what comes first? The addiction or the mental health issues? There really isn't a good answer for this because it varies case to case. It could be either, and a lot of times it's even hard to tell because one feeds the other feeds this one, the lines get blurred. You have certain substances like meth and cocaine, things like that. I mean, technically, I guess any substance, but can cause mental health issues. So a person could have, you know, not had any, started using meth and coke, and then when they get into recovery, have paranoia, psychosis issues from the substances, anxiety, all that, or any substance. There's a lot of people I know, because of what they went through during their addiction, came out with either worse anxiety and depression, or if they didn't have any prior, come out with it now because of the insane stuff they did during their addiction and the stuff they saw and all the craziness around there. You know, also you have a lot of people, if they have mental health, first they use alcohol and drugs to self-medicate. You know, a lot of people can argue if there's childhood trauma, then that probably came first and led into, you know, the addiction, substance use, whatever. So what's most important to treat first? Amber Hollingsworth, I've done a lot of videos with her. She's incredible, got some great videos. She talks about how important it is to treat the addiction first. And I really dug into this and analyzed it, and I think it's very accurate in the majority of cases. There's a couple where that isn't, and that's if the person's having like a major mental health crisis, then that's got to be addressed. But the reason to treat the addiction first is the person has to kind of be separated and detoxed from said substance and lifestyle, even if it's just a week or whatever, to get them in a state of mind where they're going to comprehend the mental health treatment. I have went with people to somebody's house who is in a, basically a mini intervention, 12-step call, whatever you want to call it, where we've sat there for 6 hours and had a heart-to-heart with this person. And they were talking back, responsive, yes, yes, this, crying, hugging. The next morning we call them to talk about it, don't remember a thing. That is why it's imperative that the drugs or alcohol are taken out of the system first and the addiction treated first. Because if you try to treat the mental health while they're still in the middle of the addiction, I'm all for planting seeds, but it's not going to go very far because they're not going to. My brain is so focused on that next high during addiction. You could give me the best therapists and mental health workers in the world. It's not going to click. It's just not. Simple as that. I'm so focused on withdrawal, next high, next this, next that. At many rehabs, they do treat both of them and they do it kind of simultaneously, but first they detox the person and then they have a combination of the recovery, the therapy, things like that. Now, there is a lot of them that, like I said earlier, one helps the other, so to speak. And that's what's good, but we also need to understand that they are, and there's a ton of parts of it that mingle, but there's parts that are separate, and we got to treat both. If I keep my recovery program great and I'm killing it, but I neglect my mental health, it's only a matter of time before that pulls my recovery down, and vice versa. So how to treat addiction? Your rehab, your inpatient, your outpatient, your detox, 12-step groups and meetings, recovery groups, organizations like Smart Recovery, Rock Recovery, all these great things, fitness recovery programs, working with a recovery coach or a sponsor, MAT, medication-assisted treatment, Suboxone, Sublocade, Vivitrol, Methadone, there's a lot of them. That can help, the recovery. Mental health treatment, you got your treatments in rehab where there's, trying to dig into the core of what's causing the depression, the anxiety, even the addiction. That's where it mingles a little bit. Therapy, many types, your CBT, cognitive behavioral therapy, REBT, rational emotive behavioral therapy, trying to get to those, emotions and what triggers certain actions, mental health medications, things like that. And then the part that works together, things that treat both, your exercise, your diet, meditating, reducing stress, reducing clutter, social events, positive social events, not isolating, staying with people, recovery events, positive family time, which includes pets, a good career that's fulfilling, a good job. All those help both the mental health and recovery. But then you got the other tree of each. So it's this balance we have to fight if you're somebody like me with both, where there's been times where I'm going a million miles an hour in a good way in recovery and my mental health is slipping, and vice versa. And it's hard to find that balance, but it's very doable. And like I said, there's a lot of overlapping that helps. I can go to a 12-step meeting and mention that I'm struggling with anxiety, and there's always people willing to talk and help and stuff like that. But it's something we got to work on daily on both aspects. If and when we do work on both, it's an exponential compounding effect to help the other, and life gets so much better. It really is. That's dual diagnosis, co-occurring disorder. If you have it, work on both. If you know somebody, make sure they're working on both, please. K. Ruggs, the Sober Dog, I'm out. See ya.